Glaucoma is a disease that affects the eye. It's mainly as a result of high pressure in the eyes. And inside the eyeball, there's a pressure that is usually measured, and the pressure is usually between 10 and 22. And if that pressure goes above 22, then the patient starts developing symptoms of glaucoma, because what happens is that the nerve that connects the eyeball all the way to the brain starts getting affected by the high pressures and starts losing the ability to see. And this will cause irreversible blindness.
I was not actually seeing well. It's something that had been happening quite often, and I would ignore, and sometimes it would happen, and then after some time it's back normal, I'm able to see. The hospital realized that they could not manage the eye because I was still not seeing. Therefore, I was advised to go to the next hospital which deals with the eyes. While there, they gave me some medicine and they were able to take the pressure of the eye. And both eyes, one eye was 60 and the other one was 61. So my journey began from that time when I was told that you have glaucoma. It's something that I've not heard about.
I started feeling like I have headaches, persistent, not really tough headache, but a headache which is just mild. Could have a headache here, a headache here, a headache all over the head. I was indoors the whole month. I didn't come out. I underwent very many tests because of the headache. I even underwent a CT scan. I was a bit nervous. The things a bit irritating. And he told me, wow, your pressure is high. That time he started now telling me 29 this eye and 29 the other eye. And that time he told me the normal eye pressure is between 11 to 22, that's what he told me.
As the nerve starts losing the ability to see, a patient starts experiencing blind spots. And this usually starts in their what is called peripheral vision, their side vision. They're not able to see the sides, but the center vision is maintained. And what happens is that the patients start bumping into objects or bumping into people. They cannot see stairs, they cannot see the sides, they cannot see the side mirrors if they are drivers. And they start realizing that their eyesight is deteriorating.
Whenever I looked at the light, I would see the rainbow. I would not see it as the light, but I see the rings formed around the light. This had taken time. I would feel pain in the eyes sometimes, and this pain would go. So I think that is when this problem started.
I had to put the eye drop twice, in the morning and in the evening.
I was told that at no time should I stop putting on the medicine because I don't need the doctor to tell me anything, because I've felt it when I don't put the medicine, what happens.
The disease is irreversible. We cannot reverse the blindness as a result of this disease. About 7% of the population above the age of 40 have glaucoma. So it is quite a big burden, and most people are not even aware they have the disease, as it is painless and it slowly progresses to blindness. And usually by the time patients are seen in the clinics, in the eye clinics, most of the time they are always blind, or they have quite advanced disease. So it is a serious problem in Kenya.
I put the first drop the first day, and the second drop the same day. The following day, 2 days, I was like I'm another person.
Those who don't know need to go for any checkup. If there is eye checkup, please go. They can also get it from the history, family history, because I think from what the experts say, is that glaucoma is inherited. While those people who have been diagnosed, unfortunately, there are people who lose their sight completely. There's nobody who would wish for one to lose his or her sight. But for those people that have little sight, let them follow the instructions that is given to them by their ophthalmologist.
Once you're over 40 years old, you should go to an eye specialist, preferably an ophthalmologist, and have a checkup. They're going to measure your pressure, the pressures in your eyes, make sure that they're within normal. As I had said, the normal is between 10 and 22. Also, they're going to check the optic nerve to see it has been affected. And if everything is well, you should be visiting your doctor at least once every 3 years to also make sure that your eyes are healthy. However, if you have a problem with your eyes, then the doctor will be able to pick this glaucoma early and start the relevant treatment. If you have what are called risk factors for developing this disease, for example, if you have a family history of glaucoma, or if you have very thick glasses, you're quite short-sighted, you have a high risk of getting the disease, or if you have diabetes or high blood pressure, then you're at a higher risk of getting the disease. So if you have any of these risk factors, it's better to see your eye doctor fairly quickly so that they can examine your eyes and determine whether you have glaucoma or not.
And life is normal. Only that I have to feed very well. I take care of myself. I do exercises. The ones who are not affected, there is no harm going for checkup. Me, I would advise people to go for checkup, eye checkup regularly. And the ones who are affected, follow up the clinic.
I still think there is hope.